So a few weeks ago, I posted a video on an interesting patient presentation. This is a 43-year-old woman who comes to the office. She has new headaches, trouble concentrating. Um, the keyword is new because if somebody's coming with something that's more than their baseline, you want to figure out why. So we did a really thorough history taking, exam, labs, and on the first glance, all the labs look normal or in the normal range. And I'll post them right here as a reminder real quickly. So when you look at all the labs that she had done, it looks like everything is normal because it's all in the normal range. There might be very tiny, low edge numbers, but one of the things that I really like doing is making sure that the presentation and the patient's symptoms and the labs actually make sense and putting all of that together. So when we look a little bit closer, you see a few things that stand out. Her RDW is elevated at 17, so this tells us that her red blood cells are starting to vary in size. Her MCV is also right on the edge there at 80, so another trend that her cells are trending smaller. But her ferritin is in the normal range, right? It's 32 reported normal on the lab panel. But physiologically, we know that that is low iron stores, especially if there are symptoms there. So TIBC is high at 435. Transference also on the high end. This is really telling us that she's trying to actually capture more iron cells because the storage is going low. When you put all that together, this patient now has early iron deficiency without anemia. Her hemoglobin is in the normal range. Now, this is important because iron deficiency can cause symptoms of fatigue, headaches, brain fog, poor concentration long before you have the hemoglobin drop. So the next step isn't necessarily just giving her an iron supplement. It's really important to figure out why. Why are her iron storage low? Why is she starting to develop early iron deficiency? So you go back to your history, make sure that you've covered all the big steps, right? Her menstrual cycles, are they having heavy menstrual cycles? Have they noticed a big change in that? Possible GI blood losses. Is it a diet nutrition issue? Did she donate blood recently? Her medications, is she on NSAIDs for ulcer, acid blockers that could decrease absorption of iron? Now, iron deficiency really is not the diagnosis, it's just the clue that something else is going on. So we have to figure out what that something else is before you start handing people iron. In a 43-year-old, I will most likely send them to GI for a scope just to make sure that we are real, especially if they have any GI symptoms at all. So, big tip, iron deficiency often begins long before your anemia develops where your hemoglobin drops, and patients can have symptoms before the hemoglobin drops. So make sure you're connecting those and evaluating the patient as a whole with the symptoms and the labs in detail and thoroughly. All right, thank you.